Sir, I have a child. She used to go on bus with me. It has been 7 months. She doesn't talk, but it is not like she doesn't respond to the instructions. She
Right.
does.
Right.
If you say anything to her, she's so stubborn by nature. If she sits on a seat, and if I tell her for her safety to change the seat, she won't. And she will start crying and all. But other things, she is doing fine. She understands instructions that I can understand by her gestures. However, she does not talk. Since 7 months, she is not talking. Even if she needs the bag, she will look at the bag. She will not ask for help. And then we automatically understand we are giving her space. But do you think such a child needs the treatment, or we have to worry about behavior?
Exactly.
Thank you, sir.
Welcome. This is a very good question. See, I don't have any other relevant developmental history of the child, isn't it? It's very difficult to give a diagnosis like that or recommend some therapies or some intervention like that. But what is the age of the child?
It's 4+.
4+. Okay. So we need to understand, as I said, that a child at 4+ age should be able to communicate things properly in social context. Ma'am, I want this. Ma'am, I don't need this. So we will not go with this fact that this child is shy or he or she is introvert, isn't it? As per the recommendations and as per the developmental levels, a child should be coming to you and talking to you. Even if she is angry, she is aggressive, she is stubborn, but that doesn't limit the social communication aspect of it. So here we have this red flag that the child has not been talking and communicating, in fact, for so many months. Whatever the reason, even if she understands things, even if she reciprocates, even if she knows how to take her own things back, but if she is not engaging socially with her peers or with the teacher or in the bus when she goes around, definitely she should be investigated for a developmental concern. But now, this should not be communicated directly to a parent because they will be upset about it. That is the reason there is a proper method that you should be administering a screening tool for the child so that you have some documentation and your parents can also understand, okay, this is a concern, it can hamper the development of the child in other areas as well.
Thank you so much, sir.
Most welcome. So, I'll just before taking one more question, because we have to wind up soon, I'll give you the general information for development so that you understand the purpose of the meeting, isn't it? First year of life of development for any children is considered as a year of motor development. First year is like child sits, child crawls, child walks around and starts exploring the nearby environment. Second year is considered a year of language development, in which child starts speaking between 12 to 14 months of age single words meaningfully. Most of the children speak like Papa, Mama and Baba, but they are not labeling it correctly to the right person in developmental disorders. Typically, developing children can do it, but children with developmental disorders have this concern that they are not able to understand things. That is the reason they are not able to use language properly. Third year is considered as a year of socialization because communication is already there, language is already there, they are motorically functional, so they start socializing. As the question was that she is already 4+, she should be motorically functional, she should be communicating properly and she should be socializing. If the child is not doing that, that is the reason she might be at risk for any kind of a concern in terms of development, okay?